Today, I don't have a guest because I wanted to talk about something new that I'm starting. Over the past couple of years, I've been talking with several physicians that are thinking about leaving employed medicine and opening up a DPC practice. And they want to know how to, as in exactly what steps to take. And we have a lot of great books now that are essentially checklists, and not just books, but online resources, many things that show you exactly how to open up a DPC practice. And truly, that was actually not too hard to open it up. I mean, it's basically, you get your PLLC and then all the steps about opening up your practice, getting your malpractice, things like that. So that part wasn't hard, but the other thing that people are really, really worried about, actually, there's a few things. And this past weekend at the DPC Women event, I saw the same things over and over that I've been noticing over the past several years. Physicians are hesitant to leave because of the fear of uncertainty. A lot of times they're scared of leaving their stable income, called the golden handcuffs sometimes. They also are fearful of what will happen. Will they open and people won't come because they don't like them? How do they explain DPC to people? They for sure understand it, but how do they get people to understand it that are so tied to their insurance? How do they get people to understand the value of having a DPC doctor? So it's very, very clear now that physicians who want to go into DPC, they don't need more information about how to open. What they need is a clear path, a transition from employed physician into independent practice owner. So today, I want to explain something that I am starting. It's called the Independent Practice Path, or IPP. It just makes me think of the song, Yeah, You Know Me. Anyway, this is not really a course on exactly how to open up a DPC. I think that there are great courses out there, particularly one that I did myself, and I have so many good things to say about it, the DPC Alliance Masterminds. It's 2.5 days of intense deep dive of how to open up a DPC practice. Great experience, and that will give you really all the nuts and bolts about how to open up a practice. But IPP is more of a structured transition from employed physician to independent practice owner. And this is structured in a way to help prepare you not only from a system standpoint to have your practice ready to go on day one, but also to prepare you from a mindset standpoint of becoming a physician owner, a physician entrepreneur, to becoming the boss. I mean, it's very difficult if you haven't been in that position before, if you've always been an employed physician. So what I've been hearing is really the uncertainty and the fear of how do I do that? How do I become a practice owner in a reasonable and sustainable way? How do I get patients? How do I explain DPC to them? How do I prepare? How do I make sure that I'm going to be able to make the income that I need? So that's what the independent practice path is. It's going through all of those things to help you transition from employed physician to independent practice owner, so that when you open your doors, you are not actually just opening. It's a continuation of what you've started several months prior, so that when you open, you've already started. You've already explained DPC to people. You've already had people sign up on your wait list so that you are ready to go on day one with patients signed up. That is the goal with IPP. So what we'll do through the program is help you get things set up before you actually leave your employed practice position. You're going to learn how to explain DPC to patients and to other people, to employers, to family members, other doctors, colleagues, and you'll start those conversations early from the very beginning. You're going to formulate several different ways of explaining DPC, because some people are going to resonate more with the cost savings, and some will resonate more with the time spent with the physician. You're also going to start building your systems And I always say that you want to start how you want to finish. So you don't want to start with a Google worksheet and just your phone and that's it. And just remembering to call people back and remembering to email them. That is not how you want to start. We started like that a little bit and it was not great. I'll say it wasn't great. It worked, but we have developed our systems since then. So I want you to have systems that you would find them in a mature DPC practice, because I want you to start the way you want to finish. And so you're going to have help with explaining DPC to people, developing the patient interest, reaching out to people. You're going to build those systems so that when people look for your website, they're going to get answers from your website. And when they call you, they're going to get answers. And there's a direction for them. There's a path for them when they come to your website and they see what you're doing and they learn about DPC and they decide they want to be a part of your practice. They have a place to go. They know what comes next. So that when you open up, you're not scrambling for patients. You're going to be preparing for that day for months ahead of time. So the goal isn't just to open your practice. The goal is to open a practice with momentum. You've got patients, you already have systems in place, your networking is in place, so you're not just opening your doors and waiting for people to come to you. And even if by the end of the IPP cohort, you haven't left your job yet, you will already have your systems in place so that you can answer patient questions, you can collect names and information, and then when you're ready to open, you will be fully supported by your systems. I'm starting this as a small initial cohort because this works best when people can talk to each other and hear how other people are doing things, and they work through some of these situations together. The physicians that I designed this for aren't just slightly DPC curious. They are fully committed. They know that something has to change and they don't want to make a reckless decision. They want to have some idea of what's coming next, what they need to do. They want to have a transition plan. I feel like the independent practice path is what I've been trying to create this for a while, and it's taken me a while to figure it out exactly the pieces and how to do this. So it's been a long process reaching this, but I feel like really this is what I set out to do over a year ago. I wanted to help doctors who are ready to get out of the employed system, ready to get out of the fee-for-service system. I wanted to help them be able to succeed in DPC. I was hearing about so many different practices where people were saying they weren't getting the patients. They were worried about staying open because they haven't gotten the patients that they thought they were going to get. And sometimes you can't really pinpoint why that is. There are certain things that you can do to try to make sure that you will succeed. And that's what I've been trying to put together is how do you create a system that helps people succeed. So I think that this is it. I'm very excited about it, and I look forward to working with several of you to get you started to opening your DPC, feeling supported and confident and having the systems ready to go to support you, whether it's just going to be you solo or you may have an assistant. The idea is to have you ready to go on day one, that you'll have patients already, that you're not just going to be sitting around on day one. We want you to have patients coming in your door for their first visit with you. If you've been listening to the podcast, you probably fall into one of three categories. One, you are a little bit curious about DPC. You're not really thinking about it, but maybe this is planting a seed in your mind about, is this possible to open a DPC? There's another group that listens to the podcast that is thinking about opening a DPC, but they're stuck because of worrying about the process of actually opening or the mind chatter about, is it possible? Can I do this? The imposter syndrome. Then there's a third group of people that are ready to change. They are very close They realize that the current system that they're in is not sustainable, and so they're very close to pulling the trigger and going DPC. So if you recognize yourself in these coaching calls and other conversations, you can't ignore DPC anymore. I always say that once you've seen it, you can't unsee it. If that's you, then you are exactly who would benefit from IPP. So if it sounds like you are in that third group and you are seriously thinking about getting out of employed practice and you want to talk to me about this, just email me. That's the easiest thing. Tell me about your situation, where you are in the process of planning a DPC, and then we can figure out whether this would be a good fit for you. Just remember, no matter where you are on your DPC journey, your DPC family's got your back. See you next week on the next episode.